Namaste, Dr. Divya Matlani here, welcoming you all in the session of yoga therapy. Today, the topic is all about the psychological and the psychiatric disorder, in which today's topic is obsessive compulsive disorder. So, let's begin the topic. Obsessive compulsive disorder, which called as OCD, features a pattern of unwanted thoughts and fears known as obsessions. These obsessions lead you to do the repetitive behaviors, also called compulsions. These obsessions and compulsions get in the way of daily activities and cause a lot of distress. Ultimately, you feel driven to do the compulsive acts to ease your stress. If you try to ignore or get rid of bothersome thoughts or urges, they keep coming back. This leads you to act based on ritual. This is the vicious cycle of OCD. OCD often centers and around certain themes such as being overly fearful of getting contaminated by germs, to ease contaminated, and also the fears you may wash your hands over and over again until they are sore and chapped. If you have OCD, you may be ashamed, embarrassed, and frustrated about the condition. But treatment can be effective. Obsessions often have themes, such as there are a lot of themes in that. The first one called as fear of contamination or dirt. Second, doubting and having a hard time dealing with uncertainty. Third, needing things to be orderly and balanced. Fourth, aggressive or horrific thoughts about losing control and harming yourself and others. Fifth, which called as the unwanted thoughts, including aggression or sexual or religious subjects, in which also examples of obsession symptoms include. There are a lot of symptoms in that. If you will find the most of the OCD patients, the most of the OCD subjects will suffer from these symptoms, in which the first one called as the fear of being contaminated by touching objects others have touched, and also doubts that you have locked the door and turned off the stove. Intense stress also when subjects are not orderly or facing a certain way, in which images of driving your car into a crowd of people, thoughts about shouting. Sometimes it is that much consistent that do not use the public washrooms as well as, and also thoughts about shouting, obscenities or not acting the right way in public. Unpleasant sexual images, staying away from the situations that can cause obsession, such as shaking hands. So, compulsion symptoms, which is called as OCD compulsions, are repetitive behaviors that you will feel driven to do. These repetitive behavior or mental acts are meant to reduce anxiety related to your obsessions or prevent something bad from happening. But taking part in the compulsions bring no pleasure and may offer only limited relief from anxiety. Other aspect of it caused as you may make up rules or rituals to follow that help control your anxiety when you are having obsessive thoughts. These compulsions are beyond reason and often don't relate to the issue they are intended to fix. So, as with obsessions, compulsions usually have themes such as washing and cleaning, checking out the things, and also counting the things and ordering the things, etc. In which also in this particular thing, so following a strict routine, it can be there, demanding the reassurance. So examples of compulsion symptoms include hand washing until your skin becomes raw. Okay, so in my family also there is one of my relative who actually has been going through from this OCD, and she has the ability, to do the wash the hands again and again. If she's in the hotel, so she used to clean the toilet seats as well. So cleaning doors over and over again to make sure they are locked, checking the stove over and over again to make sure it's off, counting in certain patterns, silently repeating a prayer, word, or phrase, trying to replace a bad thought with a good thought. So, what are the causes of it? There are a lot of causes of obsessive compulsive disorder, and I found this disorder in lot of females, actually more than that men. So, the main theories include in the causes called as the biology factor, which may be there, that OCD may be due to the changes in your body's natural chemistry or brain functions. Second, you can tell as the genetics, that OCD may have a genetic component, but also the specific genes leave yet to be found. Learning obsessive fears and compulsive behaviors can be learned from watching family members or learning them over time. So, what are the risk factors of it? What are the risk factors of OCD? Factors that may raise the risk of causing obsessive compulsive disorder includes the family history, second called as the stressful life, events, and other mental disorders. So there are a lot of complications, issues due to the obsessive compulsive disorder, which includes lot of sections in which excessive time spent taking a part of ritualistic behaviors, okay, health issues such as contact dermatitis from frequent hand washing, because your hands become so hard and the skin becomes so dry, so the person may get the problem of the skins and called as the dermatitis. Having a hard time going to work or school or taking part in social activities, because the OCD patients have the fear to take the part in other activities, to going for the trips, to going for the hikings, to going for the treks, etc. Trouble relationships as well. Poor quality of life they will get. Thoughts about suicide and behaviors related to suicide. So, what happens that here are some ways practicing yoga can help with OCD. So, regulating the pace of thoughts, breath work you can practice can help to regulate the pace of thoughts, okay, by slowing down to match physical cues such as inhale and exhales, accepting the present thought right now. Mindfulness techniques you can taught. Mindfulness encourages the acceptance and the neutral observance of a present thought rather than automatic belief or the succumbing to it. Resisting intrusive thoughts. The mental staying present imperative of yoga combined with its physical endurance aspects can help to strengthening one's ability to resist reacting to the intrusive thoughts. Again, the part of it, the calming the nervous system. So those practices which calms, for example, you can say if the person can practice Shirshasana, they can easily, definitely, why not? Because it can calm the nervous system. So OCD can cause dysregulation of the nervous system and the escalation of the limbic loop. So fight and the flight responses. So yoga can be the instrumental in calming it. Discouraging the perfection. Yoga encompasses listening to the body and adapting to the one's needs and the comfort level. It also highlights the beauty and the purpose in between rather than the upholding a singular and the goal. Enhancing the body awareness, so the people can practice more and more in terms of body awareness. Greater the focus on the physical sensation and the body cues help to somebody with OCD pay attention of the moment and trigger occurs and realize when the obsession picks up the speed and the compulsion becomes intense. So in this type of protocol, the person may practice breathing work in the starting of the session, relaxative pose, like for example child pose, cat cow pose, warrior pose, happy baby pose, downward dog pose, pigeon pose, cobra pose, shoulder stand you can practice, which I have told you, Shirshasana. Another one is the Salam Sadvangasana, triangle pose, so that your nervous system becomes more balanced. Or definitely you can take the part in terms of the breathing especially, and also in terms of breathing afterwards, the mindfulness techniques that you are present here, you are present in this moment, because mindfulness will get rid of the frustration towards others. Because when the OCD is there, the person may get frustrated because of others, because they will not, maybe not cleaned as much as they are. So this type of things will develop by the restorative habits in terms of yoga practices. I hope you will understand the OCD in a very well manner, and also about the protocol, that what things you need to inculcate it. Thank you so much for joining this session.